Hey guys, I'm Sarah Lavonne and welcome back to my channel. Happy almost New Year. I can't believe it's almost 2020. What happened to this last year? Congratulations to all of you mamas who've had babies this last year and all of you future mamas who will have babies in 2020. I've been feeling super nostalgic over the past couple of weeks and I can't even begin to thank you guys for all of the love and the sharing and the questions and the comments and for subscribing to my channel. You guys keep me going. I hope you know that, and I am just so incredibly grateful for all of you. I am back for the last Coffee and Questions of 2019. So I'm gonna answer a bunch of your questions from YouTube and Instagram. So make sure you subscribe so that you don't miss any future videos. And then make sure you follow me on Instagram because I'm doing all sorts of things over there, like lives and giveaways and lots of other fun childbirth related education over there. Today, I'm gonna be talking all about epidurals and whether or not they speed up or slow down labor. I'm gonna touch on obesity in labor. You guys have been asking a lot about that one, so I'm gonna talk about the impact that being obese may have on your labor. We're gonna touch on mucus plugs. Y'all love them mucus plugs. We're gonna talk about multiples, if you have twins, what to expect for your labor and birth, especially if you're pursuing a vaginal birth without an epidural. Delaying the hepatitis B vaccine. We talk about disengaging your baby. So this comes from my engaging the baby video. If you can disengage the baby if it's already in your pelvis. All that and many more things. If you are curious as to all the things that I answer today, everything will be in the description box down below. And then let's get started. Konina Graham says, does epidural make the process faster? I've heard it can make things relax and start things. Okay, so the answer to this is very much a flex and flow answer. It totally depends on what's happening in your labor, but sometimes, yes, the epidural can actually help your labor continue to progress. When you take my medical interventions class, I talk about all the things that can come up in the hospital setting, interventions as tools to hopefully help you have a vaginal birth. And so if you're laboring and your cervix dilates to a certain point and then it gets stuck, by stuck I mean like anywhere along the process, usually by active labor, you have to be in active labor, meaning your body's decided like, yeah, we're gonna have a baby, so it's been changing over time, and then you get to a certain number of centimeters, say 5, 6, 7, 8, 9 centimeters, they check you 2-3 hours later and you're still that same number of centimeters. For whatever reason, your cervix has stopped changing clearly. And so what we want is we need your body to relax and be able to continue to dilate, allow the baby down. And sometimes because of the discomfort or fear that you have in the room or anxiety or whatever it may be, there's tension being held in your body. And so a lot of times you get an epidural that just relaxes things. And then all of a sudden, next thing you know, you're needing to push. I've had mamas that have been laboring at home for hours and hours and hours, like days potentially, come in, they're like 1-2 centimeters. And we call them in the hospital mercy admits because technically we're not supposed to admit you that early as far as like dilation with your cervix. But because you're in so much discomfort, because you're begging for an epidural, occasionally, depending on the hospital, flex and flow, they will admit you and then get you an epidural. And so I've had plenty of patients, clients where we come in, they're 1-2 centimeters and they get their epidural and whoosh, next thing we know, they're 8, 9, 10 centimeters ready to push. And all they needed was that little extra helper to relax their body and help them to dilate. Now, the other side of things that people are very concerned about is the epidural slowing down labor. And so there's this fine line between when to get the epidural, that is it too early, because you technically want to be in active labor. You want your cervix to be changing regularly before we start giving you other things that can relax your body. Because once your body's established that pattern of contractions, then we expect you get an epidural, you relax a little bit, they may space out a little bit, but past that, then your body continues to flow with those hormones, giving you contractions, continuing to dilate your cervix. The earlier you get the epidural, if you're not technically in active labor, your cervix isn't changing regularly, there is more risk that your contractions kind of peter out and you need some Pitocin to help to kind of keep things going. So this is like more of a complicated answer and I'm getting way deeper into it than you probably asked. So moral of the story is, yes, it can make it faster, but not always. Sometimes it slows it down. But if you're super tense, if you're in a ton of pain and you can't just release and let go and you're fighting the contractions, then it will probably speed things up. Or if your cervix is stuck, meaning like not dilating super fast, you've been in labor for a very, very long time, you're having a ton of discomfort and your cervix really isn't changing with the amount of discomfort that you have, have, then yes, it can speed it up. If you want more about the epidural, not about necessarily the process, but about how to make that decision, you can go to my Should I Get an Epidural or Not video. I will link it above. Our Nicoletta says, how far do you space out 2 C-sections if you want to have a second baby ASAP? And then second part of the question is a second C-section more dangerous than the first? So first of all, the answer is 18 months. So, and that really I talk about in my FAQ of when should I have another baby or how long should I wait before I have another baby? And whether or not the second C-section is more dangerous than the first, in general, I would say, I'm hesitant to use the word dangerous, but if you're going in for a scheduled C-section, it is a little bit different as far as risk goes than laboring and having a C-section and then attempting a VBAC or a vaginal birth after cesarean. Vaginal birth in general, when you're talking about cesarean, does hold the lesser risk. And then the only difference is with the VBAC is the risk for uterine rupture goes up by less than 1%. So you just tag on that little extra. And then that's where your risk lies. So if you have a provider that will VBAC you, I will personally say that I am very pro VBAC. I'm going to encourage all of you to seek out a VBAC. That is one of the World Health Organization's Healthy People 2020 goals, is to increase overall vaginal deliveries, vaginal births around the world and in the United States. And one of the ways to do that is by attempting a VBAC. There is a 60 to 80% success rate when you attempt a VBAC that you will likely be successful. It's better odds than not. So go for your VBAC. If you're not interested at all, depending on what happened with your first, then yes, there are all of the risks of a C-section, and the more C-sections that you have, the higher the risk. So if you want like 5 babies, you should be attempting a VBAC versus having a scheduled C-section the second time around. But flex and flow on that one. You're gonna weigh that risk for your own personal body with your obstetrician. Maya Noel says, does losing your mucus plug mean you're in labor? So I'm gonna send you back to my when not to go to the hospital, which is your clue for the answer to this question. And the answer is no, it does not mean that you're in labor. Sometimes losing the mucus plug may happen as you are starting to brew things. It may happen throughout labor. It may happen weeks before. Even preterm, you can lose some of your mucus plug. It regenerates. It does not mean you're in labor. It does not mean you need to go to the hospital. It's a reason to celebrate. Yay, we're happy. Things are happening down there, but it is not a reason to go to the hospital. Anonymous, please. She says, are there any worries about being pregnant and giving birth while obese? So as far as weight goes, I think I've addressed this in other coffee and questions, but really the risk with obesity more happens throughout your pregnancy, of risks of pregnancy complications. At birth, we really do want you to have a vaginal birth because especially if you're obese, there is higher risk in the case of a C-section. So we're gonna work very hard, hopefully, we meaning like your care team and staff that I am not a part of in the moment. So I'm really hoping they're working very hard to help you get that vaginal birth. As far as other risks go, the other thing as a nurse I think about is the fetal monitoring. That fetal monitoring can be very difficult when you're obese. Just because it's harder to find the baby. And so you may expect that they may have a harder time getting the baby on the monitor. There's this new monitor called the Monica Novii that's like stickers that's especially good for obese patients. So you can ask if your hospital has the wireless kind, which is actually really great because then you're not being like strangled by the belts that come around you and they're really uncomfortable. So like this little sticky thing that goes on your belly and watches the baby that way. The other thing is I would tell you to be more aware that internal monitoring might be a better option for you given the fact that it can be really hard to monitor the baby and that could influence a potential C-section. So take my medical interventions class and I talk all about internal monitors there, but they are monitors that go inside that tell us what's going on with your contractions and your baby's heartbeat. So otherwise, worries about being pregnant and giving birth while obese, as long as your pregnancy has been normal, you are laboring, you are letting go, you are moving positions. If you get an epidural, sometimes it's harder to get you in some of the other positions like in all fours or like, you know, some of our crazy like peanut ball positions, but your nurses can work with you on that and then talk to your anesthesiologist about giving you enough of a dose of an epidural that allows for some mobility so that you're not sitting on your pressure points and like potentially risking pressure ulcers on your butt or your hips or whatever, because you really do want to be changing positions super frequently, just like if you weren't obese. So I would say not really. In general, guys, let it go. Talk to your providers, talk to your nurses about your concerns when you're in labor, have them help you change positions, and then expect the monitoring thing to be maybe a little bit annoying, and maybe be prepared for some internal monitors, or ask about that Monica Novii monitor, the wireless sticky one. Britt Hutch 12 says, baby will definitely get it, but thoughts on delaying the hepatitis B vaccine? Need delay or no? Okay, this is cool. So normally I don't get into anything vaccination wise. I don't want to start that conversation here. Y'all can have that on your other forums, but I like to keep this place nice and positive, and that can be a hot button issue. But if you are planning to give the hepatitis B vaccine, it is offered usually in the hospital or at your first pediatrician's appointment, because it's a 3-part vaccination series. They like to knock it out from the beginning. But if you want to delay it, honestly, hepatitis B is given, or like it's contracted through bodily fluid. So the chance that your baby's gonna get hepatitis B in the first beginning of their life is so incredibly slim. If you want to delay it, make sure you've checked in with your pediatrician, because certain pediatricians are going to be more particular about what they're okay with and not, and you want a pediatrician that is aligned with how you feel about things. But you are the parents, you are making those parenting choices for your child, and if you want to delay it, great. There's a lot happening in the hospital. They're already getting the vitamin K and the erythromycin ointment. And then they've just gone through the birth canal, or they've gone through a C-section and they've been born. There's a lot of new things. They're learning breastfeeding, all of that. And so a lot of people may want or choose to delay it for the sake of not stressing out the baby and not introducing one more thing to them. Or the other thought process is that you just knock it all out. They're already stressed out. You give it all and then you're let them breathe. So what you want to do, I am in full support of whatever you want to do, delay it or not. And I think it makes sense if you wanted to delay it. I think that that's perfectly reasonable, so long as your pediatrician is on board. Clitoral atrophy. Okay, we need to do a sex one, guys. So throw all of your postpartum pregnancy sex questions down here, and I will make a dedicated video on sex and pregnancy / afterbirth. Whatever you want. So throw those questions down, because I'm seeing a lot of them here. I think I could summarize it into one video. Be very exciting. So this one is going to link back to when I talked about postpartum hemorrhage, which was a previous coffee in question. Haley Wilkerson says, what do doctors or nurses do to prepare for a postpartum hemorrhage if you've had one in a previous birth? So first of all, it's awareness, because if you've had a previous postpartum hemorrhage, or you've bled too much after you've had your baby, then you do have a higher risk of bleeding again like that. So we're saying, okay, I'm gonna watch her bleeding, maybe be really on top of it in the postpartum period every 15 minutes instead of every 18 or every 25. Oops, I got going with doing other things and now let me go check. So they're gonna be a lot more on top of it. They may give you prophylactic medications depending on what actually happened and depending on what your bleeding's doing. They can give you rectal cytotec, which are little pills that go in your butt, and then they help to the uterus to clamp down and prevent you from bleeding. They're for sure going to give you postpartum Pitocin in your IV. So hopefully you have an IV, and then it's just a big whopping dose of Pitocin or oxytocin to help your uterus clamp down, help close off all those bleeding areas where the placenta was connected. And then past that, honestly, it's a wait and see. And so we know that you have a risk of bleeding again, but it doesn't mean that you necessarily will. And so we're just watching and monitoring that and then responding accordingly. So no stress to you, but it definitely is something to report to your nurses. Hey, I bled with my last one. They're going to ask you how much. They're going to ask you if you had a blood transfusion. If you had a blood transfusion, you for sure had a postpartum hemorrhage, because just if you hemorrhage, it doesn't always mean that you need a blood transfusion. But if you did, it was probably a little more serious than if you didn't have a blood transfusion. And then we'll wait and see. Kelsey Binder says, can you explain the different positions of cervix and how it can affect your birth outcome? So when you're pregnant, your cervix inside that little plug thing has a hole in it. That's the opening. That's where the dilation happens. And so it can be posterior, it can be mid position, or it could be anterior. Honestly, if you are pregnant, you are not in labor. Even if you are in labor, that piece of the puzzle where your cervix is makes no difference for your labor and birth As the baby comes down, usually we're gonna be starting posterior. So when I go inside, the hole is facing the back of you, so I have to actually loop my fingers and like pull the cervix down. It can be pretty uncomfortable. But as the baby comes down, it's going to bring that cervix more mid position or even anterior sometimes. And then that's gonna, first of all, make the vaginal exams a lot easier. And then it's naturally just gonna happen as the baby dilates the cervix and comes down and engages into your pelvis. If you haven't seen my engaging the baby video, you can go over there. I have a whole thing on how to get your baby down into your pelvis, and that will help bring your cervix forward. So posterior, mid position, anterior, honestly doesn't really matter. Ideally, we want it mid position. It's gonna make your vaginal exams a lot easier, and then that's it. So this comes from when not to go to the hospital, mucus plugs and more. Andrea Hernandez says, how would you know if it's your mucus plug or just discharge? Okay, so first of all, let me just tell you, whether it's discharge or your mucus plug, doesn't totally matter because it doesn't really make a difference for your labor. If it's obviously like, whoa, I have never seen this kind of stuff come out of my vagina, it's probably your mucus plug. But also the mucus plug can be like extra globby. Like we're talking like a huge snot loogie coming out of your vagina that's like sticky and stringy and you're just pulling and it's still coming out. Like almost like dried glue or like, he's dying in the background. Like it's like the thickest, like the glue that's like dry and snotty, but like sticky where it's just like a huge glob, like golf ball size, even bigger. That's gonna be your mucus plug. It's also more yellow, whereas your discharge, like especially towards the end of pregnancy, your hormones are changing, and so you may have some more discharge down there that's a little more watery. So globby, stringy, like thick, like a more, I just saw one where we were like, yay, and she just kept pulling and it was like this yellowy, super sticky, mucusy stuff where you're like, what is that? You've never seen this come out of you before. It's probably your mucus plug, yay. But if you see it, you see it. If you don't, you don't. Again, we care, but we don't really care that much. So this comes from my last Coffee and Questions, November 2019. Hey, I'm Valerie. Says, I had to get an NST, AFI testing twice a week for the last 2 months. Could you explain NST testing so I can refer my friends to the video? It's much easier just to send them a video than to explain it myself. So yes, I can explain NST. It's super simple. What it stands for is non-stress test, meaning there's no stress on the baby, meaning you don't have contractions. So a contraction stress test or like a CST would be if you're having contractions. It's kind of the same thing. Basically, you go to the clinic, you go to the hospital, you go somewhere where they can put on fetal monitors to look for contractions, one to look at the baby's heartbeat. You do that for 20 minutes. They need 20 minutes of a tracing to say, hey, your baby's fine. You would likely do this if you had any complications in your pregnancy towards the end. When you go to your doctor's appointments, after 37 weeks, you're going like once a week. And so typically they may put you on the monitor to see and do an NST. Make sure baby looks good. If there's any concerns, they may send you to labor and delivery to be induced for further monitoring. But usually if they're doing it regularly like this, where you have to do it twice a week or something, then usually there's some sort of complication in your pregnancy happening where they want to make sure that baby's okay. I currently have a client where they're watching the growth of the baby. And so with the growth also potentially impacts placental function, which we care about our placentas. That's your baby's lifeline. And so she's going twice a week right now, and they're watching the growth of the baby, and they're watching to make sure there's no signs that the baby isn't getting what he or she needs from the placenta. That's what the NST is for. All you do is sit on the monitor for 20 minutes. As long as everything's okay, they check you off and send you on your way till your next one. So I want to address a comment that I got. I think it's on the last Coffee and Questions, but it would link back to the postpartum depression and baby blues video. And I'm not going to read the whole comment because it's pretty long, but there is somebody here who kind of explained a traumatic birth experience that she had. And I have gotten this on a bunch of my videos where you guys come and you tell me your stories. I want you to know, first of all, I am reading your stories. I am hearing you. I am celebrating with you for the birth. And I'm also grieving with you with the loss of the birth memory. And so what I just want to say as just a quick PSA to all of you mamas, if you feel like you had a terrible birth memory, if you feel like you were traumatized or you have PTSD and you don't feel like somebody is hearing you, first of all, I am here for you. I do have one-on-ones available on my website. You can just purchase the one-on-one and then you email me and we set up a time to meet. I would love to talk through that with you, but I am not an expert. And if you are truly struggling with like post-traumatic stress disorder or depression or any anxiety or any of the things that I talked about in the postpartum depression versus baby blues video, then it's time for you to seek help. Go to your OBGYN, tell them that you're struggling and that you need a referral to a perinatal psychologist, psychiatrist. If they are not helpful, call your insurance company and tell them that you need a list of perinatal psychologists, psychiatrists, get seeing somebody so that you can process through that birth memory or whatever the issue is that's affecting you. Maybe you're bonding with your baby, your life. We want you, we meaning me, myself, and I, want you to be the healthiest, most flourishing, most connected, most living your best life type person possible. And so part of that a lot of times is we need each other and we need experts. We need people to walk alongside of us to help us to be those healthier people. I personally go to therapy once a week, and not necessarily because I'm like, oh, I have birth trauma or something, but because I want to know that I'm doing something to nurture my emotional, my mental health. And so I fully believe in it. I've seen a difference in my life. And so I encourage you guys to get seeing somebody, talking to your friends, working through some of those memories, and don't do it alone, because alone is just more isolating. Everything is harder alone. So for those of you, I appreciate you telling me your stories. Keep telling me your stories. Keep encouraging each other. Guys, if you see a comment on one of my coffee and questions or anything where somebody is sharing their heart with us, they're choosing to be vulnerable. And so let's encourage them. Even just a word of like, hey, I'm praying for you, or hey, I'm with you. I know how it feels. I'm so sorry that you went through that we can be each other's support system as well. And so that's my soapbox. But I want to address all of you who have shared those stories and who have had those hard memories and who have talked about them. Seek out help, please. I can't save the world. I can't walk alongside of every single one of you all over the world, but there are people around you that can. So find those people, partners, help them find those people, and then you can just be living your most flourishing life. Beauty APB, this comes from my How to Engage the Baby for a Faster Labor video. She says, can you disengage a baby by doing some of these techniques? So the only thing that I would say as a caution, if baby is engaged and low, would be a full inversion. Like you can lay with your belly down and your butt in the air. If baby's engaged, it's not gonna like slide out of your pelvis. That would be like way too big of a movement. But if you're upside down for a very long time, like off a couch, like I talk about in my breech video, then in theory, you could disengage the baby. So you don't wanna be here upside down for 30 minutes. But especially if you think that maybe baby's not engaged or like there's any kind of issue with your labor, it will just relax the bottom part of the uterus. And then when you stand back upright, it's gonna create more space. So I don't know that necessarily answered your question, but yes, you could if you're like upside down, like off a couch for 30 minutes. So don't do that. But if you're just laying like down with your butt in the air for 30 minutes, totally relaxed, it's not probably going to disengage your baby. Super duper unlikely, but flex and flow, because you never say never, never say always with anything related to this world. On the same video, Dara Khatri says, does this movement can be done in early weeks, like 28 to 29 weeks? It doesn't make early labor happen. So no, this will not cause early labor. You can do this at any point in your pregnancy, especially just for comfort and keeping things loose, keeping things open. Again, you're always listening to your body as far as if anything doesn't feel right, don't do it. But absolutely not. If these caused early labor or labor, then everybody would be doing them and no one would go to 41 weeks because they'd have their babies that early. So no, it's not gonna cause early labor. And then Marie Murphy says, at what weeks should you start doing all of these tips? She says 35 plus, and I say you can do these at any point, but especially come 37 weeks, you are on your ball, you are doing all these things, you're starting to loosen everything up, and you're creating that space and movement, but it's never too early to start doing them, because the more tight and the more like constricted everything is, the harder it is to loosen up. So you can be doing these exercises through your pregnancy, occasionally sit on your ball, rock your hips, keep everything nice and loose and open, and then come 37 weeks, just be a little more intentional about it, to do it on the daily. Flex and flow, don't stress about it daily, like, a few times a week or so, but especially when you're in labor. All right, so I have 2 more questions and then we'll be done for today. So I'm trying to keep them a little bit shorter. I apologize if they have felt rushed. I saw that comment, but I'm just trying to get out as much content as possible for you guys. So Paige ZZ, Paige, I've seen you. You've been trying to get this question answered on Instagram and on YouTube. So I appreciate your consistency in asking this question. So I'm gonna do my best. She says, I love how honest and informative you are in your videos. I took the fertility testing from Modern Fertility and my AMH levels came back slightly low. It seems it's indicative of a woman in her late 30s or 40s, and I'm 23. Could you give me some insight on what this means for conceiving and if there's anything I can do to bump my chances of conceiving? So Paige, first of all, let's talk about Modern Fertility. If you guys don't know about Modern Fertility, I talk about them in my Trying to Conceive video, and then I also have a story highlight on my Instagram where I went through the entire Modern Fertility process and tested my own blood, sent it off, and got my hormone levels back, and I tell you my results there. I also had low AMH in mine, and AMH is indicative of your egg reserve. So when we are born with all of our eggs there, not mature, but ready to go. And then as we get older, we start shedding these eggs. They die off. The little babies float into our toilets and off and away, and they aren't fertilized, so then they don't become a human being. So your AMH at 1.27, first of all, let me just say, I am not a fertility specialist. This is only a piece, very small piece of what I do. And so I'm gonna reference Modern Fertility in a second. But whether it's indicative of somebody in their late 30s or 40s, you need to go see a fertility specialist / start with your OBGYN and say, look, here are my test results. What can you tell me about it? And then the fact that your AMH is 1.27 means that you still have eggs there, okay? Just because it says you're in your 30s or 40s, you're not. You're 23 years old. We are going to assume that you still have eggs there. If you had like a 0.007 of your AMH level, that would be very abnormal and would mean that you virtually have no eggs left. You still have eggs left. But how I'm taking this, especially I'm 31 and my AMH was a lot lower than yours. Thank you very much. And I'm still going to assume that when I try to conceive or when I'm ready to have babies, that I still have eggs there. It just may take a little longer to get pregnant. For you being 23, still having eggs, I'd say that you're thinking about having babies sooner than later. You don't want to wait till probably 35, which is now like become the average of people when they're having babies these days. You want to consider having babies a little earlier. And if you're not ready, say you're focusing on your career or you haven't found your person yet, then I would say that you could consider egg freezing. I don't know how you feel about that. It's a pretty intense process. It's also very expensive. I am personally considering egg freezing, but I haven't totally decided. If I choose to do it, I will for sure document the process for you here. So it's something to consider. You have the information. You're gonna hold loosely to it. You're gonna say, thank you for that. I'm going to trust in my body that when the time is right, I still can get pregnant because you still have eggs in there. For the rest of that conversation or all of your other questions, I'm gonna send you to Modern Fertility because they included with your package, you get a session with a fertility nurse. So they can talk through specifically your results. They can give you recommendations. So take advantage of that call that comes with it. It's no cost to you. And then you'll get more information from an actual specialist in that field. Last but not least, Carmela 007007 says, just found your channel. Will you do a video about natural birth with multiples, meaning twins or triplets or quadruplets or however many babies you got in there? Also, pregnancy prep with herbs and supplements as well during and after pregnancy. So I've talked about this before, but Ritual for sure is my favorite supplement. If you're trying to conceive, start taking them. If you have conceived, take your Ritual vitamins, take your prenatal vitamins. Magnesium's also another good one. I talk about that in a previous Coffee and Questions. I have seen your requests about multiples. And so first of all, I wanna know what you want to know about multiples and pregnancy. What are your specific questions? Because I will put together an actual YouTube video about multiples. But you specifically ask, will you do a video about natural birth with multiples? And by natural, I am going to assume that means vaginal and maybe without an epidural. So with those two things, first of all, babies, let's talk about twins. Triplets is a whole nother story. With triplets and beyond, you're probably having a C-section. I don't know of any doctor. There might be some out there, but I don't really know of a doctor that's going to deliver vaginal triplets and beyond. But twins, you can deliver vaginally. The key here is both babies either need to be head down or first baby needs to be head down and then the second baby can be head up. Like that. If that makes sense. So you need the first baby, the one presenting into the pelvis, being head down, then you are a candidate for a vaginal delivery. Can you do it without an epidural? Of course, you can do whatever you want. You have to understand though that first of all, you will be delivering 2 babies without an epidural, which is uncomfortable. And the risk with the second baby is that the cord can prolapse once the first baby's out. That equals an emergency C-section, even though you've delivered vaginally, super fun. Or they have to reach inside and turn the baby with their hands. And by inside, I mean like legit up your vagina, inside, grab the baby, turn the baby, and then kind of let the baby come down into your pelvis and deliver that way. So that can also be rather uncomfortable, to say the least. And so you need to know that that may be coming. And in the case of an emergency C-section, if you don't have an epidural, they will need to put you to sleep. That goes for all of you. If you don't have an epidural and there was an emergency C-section, they would use general anesthesia. You'd be sleeping and you're not awake for the birth of your child. So food for thought. If you want more information about that, throw it in the comment box down below and I will come back as I'm prepping for that video. But can you have a baby vaginally without an epidural? Babies vaginally without an epidural? Absolutely. And you can weigh those risks with your doctor. Probably not your midwives, because most midwives aren't going to take twins as well. So with your doctor, you can talk through what your options are. It is an option. That is all for now. Thank you guys so much for being here. Thank you for an amazing year, guys. I know I said this in the beginning, but I just could not be more grateful for you guys for subscribing, liking, commenting, engaging with me. You keep me going. Running this business has been a lot for me. It has been totally amazing, but also like your comments and your positivity and your encouragement keeps me going. I don't think I would have stuck with it, to be honest, without you guys. So thank you so much. Happy New Year. If you want more from me, you can go over to my website. Everything's in the description box down below. Guys, take your childbirth classes, take your coping with labor class, your VBAC class. All of that information is only going to help you feel more confident and empowered going into your labor and birth experience and help you have that positive birth memory. Make sure you subscribe down below, give it a like, share it with a friend, and then until next time, don't forget to flex and flow, and I will see you next year. Bye, guys. Welcome back to my channel. It's gonna be one of those days, I can already tell. Welcome back to my channel. Channel. What is that? That doesn't sound like a helicopter. I don't know. Okay, ready? Okay. Okay. I was not a cheerleader. This car is insane.
What in the world is this guy doing?
Oh. Okay. What's it called? Big glob of a mucus.
You're doing this on purpose.
No, I'm not. I am trying to make it understandable. Shh! You're ruining it! He's dying. No, I'm actually trying to describe it! Just gotta pull up my pants. Suck it all in. Right? Is that okay?